Thank you so much for tuning in today. Welcome to Just with Sherry. Welcome back, everybody. So, I've been wanting to talk about mental health for a while because I think it's a very important topic with a lot of misconceptions around it. So, you can imagine my excitement when my guest today decided to come on the podcast today to talk about this. So, she's a clinical therapist with years of experience under her belt. And welcome to Just with Sherry, Van. Thank you so much for being here.
Anytime.
So, for a viewer who is hearing about mental health for the first time, so just a random person who either has never heard about mental health or is just has heard random things that doesn't really know what it is, what would you describe mental health to be? Like, what is mental health?
So I would describe mental health as, an individual's state of mind pertaining to their emotional well-being. And that would kind of link to various things because every one of us have a mental health, the same as, our physical health. And, in terms of our emotional well-being, how we are adjusting to life, the relative like freedom from anxiety and disabling symptoms, if you will. I'm kind of borrowing a little from the American Psychological Association here. The ability to, as mental, like in many ways, just to kind of make it more informal and easier to understand, every single one of us have mental health.
Okay.
And it's our ability to really establish constructive relationships and deal with the regular demands of life and stress that we have.
Great. I like that description and just that explanation because it's so simple for like anybody to understand. And like even me, like I've been doing a lot of research and trying to know more about it for myself and also for other people. So like just listening to that, I feel like everybody could relate to that. So what would you say are the most common misconceptions around mental health? Because, for example, in places like Africa and Asia, I think it's still a taboo to talk about it. I think it's not fully understood, but like just to explain it again to the random person who doesn't have a lot of understanding of it, what would you say are the most common misconceptions about that?
So, and thank you. I love this question. And the reason why is because mental health is stigmatized,
Yeah.
and is contingent upon each culture. And the reason why, I think that, this is very important, Sherilyn, is the fact that I really want to, you know, um, kind of like break down what, you know, the difference between mental health, which every single human has, um,
Mhm.
versus mental health illnesses.
Oh,
Um, so there's a huge difference because if you think about it, every single one of us who are living, breathing, walking, and surviving, we need, a certain amount of ability to really regulate our mental and physical health. So, kind of going back to your question, Cheryl Lynn, is when individuals take mental health and then stigmatize it. For example, if someone is seeking mental health support or they're not able to, or having challenges with decreasing anxiety or maintaining themselves, I think when it is stigmatized, that will prevent the individual to seek out support. And that's when, and it's contingent on the culture. For example, I am Chinese and Filipina. And certain individuals, when they realize that, mental health challenges are upon them, certain individuals, they are apprehensive with seeking support because at that point, they're internalizing it. They're
okay.
thinking, as a human, oh, I am weak. Or, there's a fear of burdening someone else, like my family. Or there's like a strong adherence, to kind of due to the Asian culture, to kind of conform with what everyone else is saying, therefore neglecting their own mental health, which they do not realize that actually exacerbates the mental health conditions.
So like, at what point would you say someone should seek for help? So if, first of all, how does one even know that they've gotten to a point where they're having mental health illnesses? Because I've seen people, I've met people who, I mean, I'm not a clinician, right? But just from the way they describe certain things and the things that I've read, in my mind, I'm like, this sounds like anxiety, or this sounds like this. But from the way they're talking about it, you can tell that they don't even know that it's something they should seek help for. So like, that's why I'm asking this question. Someone who doesn't know, how would they know that there's something going on to the point that they should seek professional help?
I love that question, Sherilyn. There's like two answers I'm going to give you. There's actually more answers, but if an individual recognize that, their daily task or activities are slowly kind of, breaking down, or they're not able to really function the normal way that they used to, or if there's certain aspects of anxiety that now is really affecting them more negatively and impacting more negatively than the past, I definitely think that that's when they should be reaching out for help. And then the other answer I wanted to give you is, in certain cultures, it's the norm.
Okay.
For example, in a household, because like I focus on trauma as well, for certain household that hold on to a dysfunctional family dynamic, it's when you're able to kind of contrast your family dynamic with another family, or you're able to view certain individuals and you're wondering, oh, how come they don't have to worry? How come they're able to complete this task? And for me, I'm having more challenges with this one task. When you're able to kind of not compare and contrast, but when you're able to really be reflective and think and recognize that there's a difference between yourself and someone else, that's the best time, like to really start looking into your own mental health and what you need for yourself.
I can absolutely relate to that. The point at which it starts to affect your everyday life, where you start to notice that certain things that you should be able to do, you're struggling with. And maybe they're things that at some point you were doing right. And then when you again see other people and you're like, oh, this people seem not to struggle with these things. Like, what is it that is going on within me that is making me struggle with this? I definitely relate to that. But there's something you mentioned I wanted to touch on before I talk more on anxiety. You mentioned trauma.
Mm.
And why I find that particularly interesting is because, well, two reasons. I read a book
Mhm.
that talked about trauma and how everything that we do now and the way we are was shaped by things that happened to us when we were younger.
Yes.
And I mean, it was a long book and it was very interesting because that kind of made me realize how much, be it, I mean, trauma might not cover every single thing that has happened to someone, right? But the bottom line is our past has a lot to do with how we are. So again, talking about different cultures, which a lot of things are culturally acceptable, but they're not really okay.
Absolutely.
And those things tend to cause trauma.
Absolutely.
How does one realize that that is what they're dealing with? And how do you tackle it?
Um, so I love that question, and maybe we need to have another session after this as well.
Sure, absolutely, we can do that because trauma is a whole different conversation.
It really is. So how do we, first of all, we have to identify, and I want to kind of go into the defense mechanisms,
Okay.
especially if growing up in a culture, right? For example, I have supported individuals, who went through the Khmer Rouge, and their norm, like not their norm, not the norm that they want. They heard stories of how their own relatives were slaughtered, murdered,
Wow.
raped, and sometimes through storytelling, and certain individuals who are older, they're telling it as a way to express what happened, but kind of in some ways vicariously traumatizing other individuals who are of younger descent. There's like a difference between, if it's impacting your active activities of daily living, which is when you're realizing that I can no longer get up and brush my teeth the way I used to. Or if you all of a sudden hear something that reminds you of that experience, and instead of just stopping for a second, you're actually crying.
Yeah.
And your ability to really function through whatever activities or that day, or for some of my clients, even for months, is halted, or even to the point that kind of maintaining yourself takes a longer time. um and even not even talking about the hopelessness or the despair. Certain individuals, when they kind of get into, and once again, this is like your question is a beautiful question, but it has a lot of answers to it. For certain individuals who go through trauma, sometimes they're not even aware when the last time they were actually happy was.
Wow, that's deep.
Mm.
Someone that is in that situation, that is like, feeling like they don't realize the last time they were happy, or they're going through some other type of mental illness, and they've gotten to the point where they want to seek help, right?
Mhm.
What would be the first step? For example, I know there's therapy, I know there's medications, I know there's a lot of things, but I'm just, again, thinking of a random person who doesn't know much about
Mhm.
how to go about it.
Yeah.
What would be the first step?
The first step is really just listening to your body and your mind. The very first step is listening to yourself, because far too often, for example, sometimes if we listen to our community, or an auntie or an uncle or someone who is in denial of their own mental health challenges, they will
Yeah.
continue to tell you, no, that's not a problem. That's just something that you have to deal with. But you need to listen to yourself. Even if our family members love you, listen to what your body and your mind is telling you, right? That's the first step. And through that, it could be challenging, especially I have clients who may have family members or friends or community members who are supportive, but sometimes not always so. So if they have individuals who continue to, you know, sustain, their denial with the family or generational trauma that they continue to hold, I always tell individuals, listen to your heart and your mind and your soul, and tell yourself, I need to get down to the bottom of it. And it could be a little harder if there's, a limited support for you, but reach out to other individuals that, resonate with you. Someone who you kind of admire, and wonder, oh, that individual, it seemed like they have anxiety, but it seems like they can manage. Little do we know, sometimes some of my clients actually say that when how they were referred is by a friend in the community who actually said that they're going to a therapist.
Wow. That's interesting. So basically reach out to people in your community that you feel you admire, you look up to, or you feel could be of help.
Mhm.
And then the next step after that would be, is it to seek therapy, did you say?
Absolutely. I wholeheartedly believe in therapy. In my culture, we are asked to repress your emotions.
I know about that.
Right? Sherilyn, I don't know about you, but the moment that I shared that I was anxious, they said, "Oh no,
Pray
you're just
about it.
right. Yeah, just pray about it, or you're weak. You can get over it, right?"
Yeah.
But is it easy, Sherilyn, for you?
No, it's not that simple, because when you have something like anxiety, I mean, I'm telling a clinician about it, but like, you know what I mean. When you
Mhm.
have something like anxiety, it's not as simple as you feel worried.
Mhm.
That's I think what people don't understand. You're not just worried about something. It can be very crippling.
Mhm.
It can cripple your thoughts, cripple your routines, the things that you used to do so easily before. Like
Right.
all of a sudden, you struggle to do them. Even getting up from bed,
Mhm.
and doing your everyday work and workout or whatever it is that you do, it can affect it. So it's not, that's the part people don't understand, like at least some people.
Yeah.
Being anxious is not the same thing as just being worried about something.
Absolutely.
And one of the things that you learn in therapy is how to identify your triggers and how to cope. Because, and again, I'm speaking to a therapist that I'm like I'm saying things you already know, but I'm just saying from my own perspective, right? That's what it really is. That's what you learn. It's like, how do you live with it in a way that it doesn't stop you from living your life to the fullest? That's really what the goal is. So it's not the same thing as just being worried about one thing or two things. It's a whole condition that can affect everything about you if it's not being taken care of.
I love the way you said that because Cheryl, here's the thing. I might be a clinician, but I'm gonna tell you your words, your power statement, who you are, and your perspective on anxiety. That is your narrative. And every single person's anxiety and how it affects them, it differs from one person to another as well.
Yep.
So I love the way that you also indicated, you gave like a very um open and expansive idea to individuals who kind of who are able, if they're listening to this, right, when they're listening
Mhm.
to this, to better understand that there's a difference, right?
Yeah.
And the other thing that I also want to bring up, if that's okay, is you know uh, like with anxiety, um it's a normal, right? It's a normal phase of emotion. Sometimes we require anxiety, just that feeling, or we have it because it's triggered from our amygdala, right? To have anxiety to finish our homework assignment, or just to kind of
Yeah.
make it to this like amazing session, or just to complete, like to complete their task. It is when it is a continual, process where they're not, it's when things are not utilized to help cope with managing that anxiety. That's when it starts to affect the individual. And that's when they start having an anxiety disorder, which, I want to say that it doesn't mean that that individual, there's any problem with that individual. That might just mean, in my perspective, and I reframe things, that means that that individual was that important to have all these projects and things in their lives. And, seeking help to me is just a better way to maintain their mental health.
Yeah. Like the healthiest person in a room is the person that takes care of their mental health. So
Absolutely.
if you're talking about strength and weakness is ignoring a problem and pretending like it's not there.
Hmm.
Strength is acknowledging a problem and taking the steps to solving it. So I wouldn't call someone acknowledging that there's something going on and wanting to do something about it weakness. But unfortunately, some people don't know that. But yeah, I mean, even I had to learn that. Like, I don't know that I was always so open. I mean, I didn't know. I wouldn't say I wasn't open. I didn't know anything about mental health and all the different illnesses that there are and how people cope and just how even you who might think you have nothing going on in terms of like mental health, illness, anything, you actually do. So it's like, I didn't know any of that. So I won't say that I don't blame people that don't understand. I guess that's the point, because you really need to go out of your way to learn about it, to understand. And it's again, very, very common. Like most people have something. It may not be, because I think a lot of people, when they hear mental health, they're thinking, oh, depression or clinical depression or things like that. But there's so many things. Like, I mean, there's ADHD. I think that's also under mental health, which is very common. Like many people have it. There is so much, I mean, just so many things. And I mean, I learned that reading books and, getting informed on it. And I realized that I don't think there's one person I know that
Hmm.
doesn't have something.
Yep.
Some
Absolutely.
everybody has something. So when you understand that everybody has something, then you understand that the only way it's if your situation is getting to a point that it's affecting your everyday life, to seek for help. That's
Mhm,
the only way, and not to ignore the problem or, just say, oh, I'm gonna, I believe in prayer, but
mhm.
we also need to, I guess, make use of the things that are available to us and that God has given us, right? God made therapy available. God made so many things available. So if we're going to talk about like prayer, let's also make use of what we already have.
Yep.
That kind of thing.
I
So,
I love that because Sherilyn, it's so funny. I had a client like a little while ago, and she came to therapy, and I believe it was a mandate. Um, but she came and she kept saying, I am fine. I'm gonna pray everything away. I'm here because I need to just check off the boxes. And I said, that's fine. And at one point, well, a few points during our sessions, there were certain things that she was reluctant. And also when you go into therapy, I want to remind people no one else will know that you're going to therapy. Everything is confidential. And, this is a safe place that we want to make sure that our clients are aware of. Right. It's not the same as going to your next door neighbor and saying, oh, this is happening. Not to say you don't you can't trust your neighbor, but this is a definite safe space for individuals to share, what they're going through. But going back to this one client, Sherilyn, she continued to say, I'm going to pray everything away. I just enjoy your presence. And I said, you know what? If we're going to go into the line of prayer and God, let's go there.
mhm,
Um, but what if God sent you me?
exactly.
Right? What if this is the message that God is sending to you and you are declining this the re the very prayer that you just sent out?
Oh,
So does that mean that you are not trusting in your own prayer? And this client said, "Oh, I didn't think about it." And the moment that, and prayer can be very important. However, eh, when you're neglecting certain aspects
mhm,
of what the prayer means and what that, when you're praying, it should be wholeheartedly, being sent out and your ability to really truly receive what you sent out. And I asked this client, if you believe in your prayer, then you need to believe that you can receive it. And she changed everything around after. She was able to go with me to learn cognitive behavioral therapy. She was able to learn a lot of things. And then she truly was able to make progress like nobody's business. So I was really proud of
wow.
this individual. Yeah.
Wow, that's great.
Hmm.
That's great. So, what would you say about medications, right? A lot of people have issues with taking medications. I mean, I won't lie, I am not a fan of medications either, but again, I don't know a whole lot about them. So, I wanted to ask you, at what point, or maybe let me rephrase it, do you think one has to take medications if they're struggling with certain mental illnesses, or it depends on what it is, and it's possible to just get to a good place without taking any medication?
Um, so I rely on my client's self-determination.
Okay.
So what that means, and I know Charlene, you're like, that's not an answer. Okay, but I will explain further. For example, I have some clients who were forced to take medication, and what not a lot of people neglect to see is certain individuals, if at a younger age they're forced to take certain medications, and they were given misdiagnosis in the past.
Wow.
Yep. Um, and they have that traumatic event associated with it. So the answer is like it really depends on the person. So let's just say, I have a client, have a few clients that went through that. And at that moment, if they choose to go through talk therapy, which couldn't, for me, I utilize an eclectic um variety of modalities such as cognitive behavioral therapy, dialectical behavioral therapy, internal family systems, and I'm about to do EMDR. However, if the individual is willing to push forward on the work to therapy instead of medication, then we're going to go ahead and make that treatment plan. However, if an individual is really struggling and, it's to the point that it's debilitating, I will talk with the individual, you know, um, about perhaps maybe finding a prescriber that they can trust and work towards that. But I do not force my clients to take medications. If they are really reluctant to do it, so I'm kind of in the middle, Sherilyn, where I have seen individuals who come into our sessions and they're like, Van, I do not want to take any meds. And I'm like, okay, well, let's go on and let's see what's going on. And I have one very client, dear to my heart. And during the fourth session, there was ADHD symptoms that she could not slow down in the session. I would redirect various times, and it was hard for her to slow down. And I said, because of the rapport that we developed and the trust that she has in me without just judging her, I said, I want to be here for you. But your thought process, I'm guessing there's like, I jotted it down. There's 15 different topics that you just went to within a span of 3 minutes. I don't know if I can be of support if we don't try to expand and gain more support. And she just says, Van, you're right. I might need it. And so at that point, and she's African American, an amazing individual, and she says racial trauma is real. Like negative racial impact has prevented her from wanting to seek, medical and or mental health support. And I said, I got you. Let me refer you to someone. And being the ally in supporting her to let her know I will be here. And not a lot of therapists really have that bandwidth, I just want to say. But with this individual, when I referred her to the prescriber, I was also as a collateral supporter. So should anything happen, I would kind of be in the middle to kind of help advocate for my client to make sure that she does not feel that additional fear, right? So after we connected her with a prescriber that she trusted, and after she became more comfortable taking the medication that was prescribed to her ADHD, um, she is in a whole better, her quality of life, Sherilyn, has improved so drastically. And
Wow.
she is amazing. And she decided that she was reaching out for that support. Um, and her life has changed drastically.
That's wonderful. So hearing you, what I understood is in some cases, medication is advisable. In some other cases, it's not necessary. And it is unique to the individual and specific situation that they are in terms of their mental health.
Absolutely.
That sounds good. That sounds good. I wanted to ask you, right? Two of the most popular mental health illnesses that people hear about, we hear about anxiety and depression, probably depression the most, and then we hear about anxiety as well. And a lot of times people don't know the difference. Like they just kind of describe it the same way. So out of curiosity, both for those who don't know the difference and also just for those who maybe want to understand it more, what would you say is the main difference between depression and anxiety?
Mhm. So, anxiety is, it's kind of coupled with certain things, physiologically. So if we are anxious, it will bring up, sometimes racing thoughts, fast breathing, right? Because you're anxious and that can, and then I'll bring up other aspects later, but when you're anxious about certain things, your body has a different way of reacting to it. So you might have like certain eh, like aspects of, feeling like your heart is racing, or your thoughts are just going really fast pace, or you are not able to really breathe, because you're so anxious about, let's just say, putting food on the table, or how to keep people, your family safe or yourself safe. When an individual is anxious, right, what happens is sometimes you can find yourself, just having slurred speech, or being impacted with pins and needles on your legs, or, there's certain aspects of it that kind of affects you. Depression is when you're more of on a low, which is your, activities of daily living. You're no longer doing the things that you like. It's like on the other side of things, which you're no longer talking to your friends and family. You're isolating. When you're kind of feeling blue and, feeling that nobody's there to help. Anxiety is more so, I'm going to go and get it. I need to get this done for survival purposes. Depression is more like, the momentum is a little different. It's slower. And when individuals get into the depressive state, it's more of a lull. And their mood starts kind of decreasing. Their interest definitely decreases. And every single person's symptoms, it kind of comes across a little different. I hope that answered the question.
No, it does. It does for sure. And that also leads me to my next question, right? So depression is feeling low, like you're not able to do the things that usually make you happy. Nothing is really making you excited and happy anymore. So what would be the difference between clinical depression and depression? Because I know I've heard that they're two different things.
Yeah. Like, for example, it depends on the months too. So when you're meeting with a therapist, the therapist will ask you, how long have you been here? Were there any external factors, any factors such as like a recent death? Any factor would be, you would be going through the grief process, of course. But you will not be given the clinical term unless it is impacting your, daily living. Does that make sense?
Yes.
Right. So it's like, for example, it's kind of like normal. I don't like to use the word normal because what is normal, right?
Mhm.
But the baseline of an individual, if somebody that they truly love pass, there would be, the 5 stages of grief that they're gonna go through. Not linear, it won't be like,
One
exactly.
after the other.
But and let's just say afterwards, and there's no definite time in terms of when they're going through that grief. That's when, the helping professional will be able to decide, is this now falling into, clinical depression, or is it what is it, where is it, and how is it impacting? And the severity of it also matters. So that's when it changes from depression to that clinical depression.
So there's situational depression, depression that is being caused by a specific event in someone's life.
Hmm.
And then there's another type of depression that is different. So that other type of depression, right? Is that caused by biological factors? Is it like inherited?
It could be. It could be. So knowing historically what your family members have. And far too often I'm hearing from some of my clients who have generational trauma. Far too often I'm hearing from my clients saying, well, my grandpa or my grandma and my parents refused to get diagnosed. So it's
Oh.
undiagnosed. So when they're sharing the stories, I'm like, oh, that really sounds like PTSD, especially when your grandma's so hypervigilant and, just screaming, and not being really able to manage themselves that well. That definitely plays a part in diagnosing.
And then there's the one that is caused by trauma, right?
Yes.
Untreated trauma can lead to depression.
Oh, various things. Um, Unprocessed and untreated trauma can lead to a myriad of diagnoses. You know, such as PTSD, CPTSD, which is complex and multiple traumas that, are not addressed. It could lead to, but not always. It depends on the individual, depression, anxiety. Certain individuals who have, pre-existing conditions in their family, such as bipolar, borderline. It can also be passed on to the next generation as well. It could be, but not always.
So we have physiological, biological, and environmental factors that can lead to depression or anxiety or any other type of mental illness.
Absolutely.
Okay. This That's good knowledge. That's good knowledge.
And I think that if we continue to stigmatize mental health, this is what a lot of people need to know, that our mental health affects our physical health. What that means is if there's unprocessed trauma, it can actually increase cardiovascular disease. Certain individuals who continue to push down their problems, it can manifest itself into ulcers, right? Heart attacks. Certain individuals, you can see that there's a link between anxiety and GI issues. So it's very important for us to really start looking at mental health through different lenses and really looking at it as I'm going to take care of myself and my overall well-being versus that part that is stigmatized.
Yeah, I actually have heard this before, what you just mentioned. I've heard that anxiety is directly linked to a lot of just like you said, cardiovascular, like heart and diseases of that sort. So if it goes untreated for a long time, and but untreated means, of course, you're not doing anything to cope with it,
Mhm.
then you can end up having physical reactions to it. Is that's the same for depression as well?
I would say so. I would say that, let's just say, if like a case, right? If an individual is depressed for whatever factors, and it's contingent on the intensity and what the situation is. Let's just say an individual is grieving the loss of, you know, someone very dear to them, and they continue to go on without support. Certain individuals can kind of continue with that baseline, right?
Right.
However, it really is contingent on the resources that they have in their lives. Certain people continue to kind of be in that baseline and go to church once in a while or reach out to a friend, and they continue to be there. But they'll hear their friends saying, "Hey, you're not joining us in these groups anymore." They will hear their friends saying, "Yeah, well, you used to enjoy this, but not anymore." And then, you know, and then at that point, their friends, or if they have anyone in their lives, or if they do not, they're able to kind of maybe not see that their symptoms are actually increasing and debilitating to the point that it's actually expanded even more so. Does that make sense?
It does. I heard that meditation is one of the coping mechanisms for anxiety, maybe also depression, I'm not sure. Do you think it's very useful, meditating?
I love meditating. I'm laughing because just the other night with one of my clients, you know, she was going through a breakup, and there's a lot of internal conflict that she has, a lot of self-blaming, self-sabotage. What did I do, in this breakup? Whereas the reality, the evidence is it's not, we don't look at who's the culprit. Sometimes things
Yeah.
happen. That's life, right? But I'm laughing because guided imagery is something that is of a meditative form, and it helps you be mindful of what is going on in your thoughts and your body. And you're actually taking a mini vacation to
Mhm.
restore yourself, to really listen to yourself. And it's proven, it's a proven method for individuals to utilize. And my very client actually just sent me an email saying how amazing it was with guided imagery, because it kind of helped her get to a place where she's able to really listen to her heart and decide, what is going on. But being open and, to receiving what her body and her mind is telling her, listening to the message that she's telling herself.
I love meditation. And like when I started at the beginning, it was like, oh my gosh, how do I get my mind to be silent for so long and focused? But like eventually, if you do it over time, it gets better. And also the different types of meditation. Like recently I found one that is like a Catholic kind of meditation, and I'm a Catholic. So like it combines Bible verses with breath work and things like that, and that works perfectly for me. So it's like I get to have my prayer time and my meditation time at the same time. Just kill two birds with one stone.
I love
So yeah, I think it's wonderful. Aside from like for mental health, it just helps overall. Like you feel better. You align your thoughts, your feelings, and your physical your physical being. You know, everything just kind of aligns and goes together as long as you do it like regularly. I
yeah.
think it does that. So my last question, and I know that this is something that a lot of people who are probably right now feeling crippling anxiety, feeling so down, either because of situational depression, whatever depression that is led by some kind of trauma they've endured, they're dealing with trauma, or whatever other type of mental illness. Is there light at the end of the tunnel? Is it possible to live a healthy and happy life while struggling with some type of mental illness?
I think that there's definitely light at the end of the tunnel. Everyone needs to know and hear that. But sometimes when people are in the midst of, whether it is anxieties, a boss is forcing you to do certain things, or depression, when you're feeling so isolated and nobody understands you, like two aspects of it, I want people to know that there's always hope, there's always light. You just have to give yourself a chance. And, with a crippling anxiety and depression, I have met a lot of individuals who has given themselves the opportunity, through listening to themselves and really allowing themselves that that freedom to explore themselves and reach out for help, you know, seek a therapist. And if you found one, or if, individuals I have heard had, a negative experience, imagine it as shopping, you know,
Yeah.
find one that fits your needs. And somebody who vibes with you, and don't give up, and in the name of, if I love all types of meditation, like you said, and if we are speaking in terms of, you know, I can't go to therapy because I have the Lord, and maybe seeing this as a sign for you to get help, because there is definitely, a light at the end of the tunnel. We just need to believe and have faith in that.
Thank you so much. Thank you so much for being here, and thank you for all the knowledge that you have impacted us with. And my hope is that for all those that are listening, watching, who either are going through something, are going through some sort of mental illness, or know someone that is going through some sort of mental illness, that by listening to you today, that they have gotten the encouragement and the information that they need to seek the help that they need. That's really like what my hope is. And I hope to also have you back to talk about more things like trauma. I really want to go deep into trauma because I've read about it and there's so much to know about it, because I think that also is something that kind of impacts everybody, but a lot of people don't know. So again, thank you very much for being here. So all those that enjoyed this episode, please go to the comment section, share your experiences, like, subscribe, let us know what else you would like to hear about within the topic of mental health, within any other topic that affects you personally. Thank you very much for tuning in, and see you next time.